All right, so we're here with a patient today who just recently completed his PAE procedure about a month ago. Sir, what were your symptoms like before you had that procedure done?
Primarily, it was like just a more frequent urge to go, and I had a high PSA, or height that had gone up from what it had been the last preceding years. So I thought I should get it checked out. That's why I came here, and I had an MRI. That turned out well. They said cancer. I had a urine test. The doctor's office here said, oh, that turned out really good. So I decided to do this to basically improve my quality of life and hopefully diminish my PSA and my had.
What made the PAE procedure specifically more appealing than other routes?
It was the less invasive. I was a DEA agent in my life, and I really don't trust the pharmaceutical much, so I really would kind of want to stay away from the drug treatment plan. And talking to Dr. Kelly, so I think this would be good. I met with the other Dr. Roth, who actually does the procedure, and probably mostly a friend of mine had it a couple months prior, and his turned out really well. So I thought, I hate to say that I used my friend as a guinea pig, but I did.
Yes.
And it worked well, so I just thought that was, in my personal primary care physician said, hey, I think this is the least invasive, you should probably go with that too.
And then, in terms of the recovery, was the recovery painful at all?
No, actually not. And I've had two other friends. I had a friend that went to El Paso. He had it probably a year and a half, 2 years ago. His PSA was high, and he actually had the laser ablation. And he had a lot more difficulty than mine. And then my other friend had this, and had hardly any recovery. And I was fortunate enough to have it too, hardly any recovery, maybe within a couple of days or even minimal sore.
And then you didn't need a catheter after the procedure either.
No, and that was the best part. Like
Yes.
when I was there that day, the gentleman that was there before in recovery said, that was the worst part. And so when Dr. Rod's folks came in, I said, yeah, if there's any way we can do this, I've never had a catheter, and I'd like to think this like not ever having one.
Yes.
And they said, well, we can get in there and do this, why not have it?
Yeah.
And so he did, and it worked out well. I was pretty happy because I told them that I had a bad reaction to opiates, synthetic or fentanyl, and so they used that minimally, and I didn't even get nauseated or sick, so I was
okay
with it all.
And then the procedure, how long did it take?
A couple of hours. It was great. I mean, I had, just because of some of my last issues with surgery and nausea and that kind of thing, I had a couple of Cokes. I didn't even use them. I mean, just to settle my stomach.
And then, how are you feeling now in terms of your symptoms and how everything's going after about a month after that procedure?
Really good. I think that my symptom is as far as urgency to need to run to the bathroom, and at night I have diminished, so I'm pretty happy with
And you're not on any medications at the moment either
No.
for your urination? Okay.
No, in fact, I was like really averse to that because I talked to Dr. Kelly, so prostate is enlarged, and it's not going to go away on your own. This seemed like the best option and the least problematic, because I had talked to my other friend that had the laser ablation, and then my other friend that had this procedure with Dr. Rao. And I thought, I'm going to try this one.
Yeah.
I'm a coward. I hate pain.
Yes. All right. So it sounds like overall the procedure went really well.
I am. The worst part of it was to get the IVs. That was the worst part of it.
Yes.
And then they used a little paint filler stuff on there. They said it was great. And it seems to be getting better all the time. I mean, 3 or 4 or 5 years down the road, I would have opted for the solution again. If my prostate enlarged again, I would probably try that again first rather than some of the other options.